Welcome to the Nurse Station. I'm Maria Mobley, and this video will discuss tips on how to be successful in nursing school. I first want to shout out my students. A lot of these tips come from watching them. They're amazing. Be successful time and time again. I teach in an accelerated RN program. My students are amazing, so shout out to you guys for me being able to watch you, to also be able to share this information with other nursing students. So I'm going to give you 5 tips that I think will absolutely help gear your success in nursing school. And step number 1 is to know how you learn best. As an instructor, we don't know how you learn best. We can give you tips on how to study, tips on different ways to study dependent on your learning style, but I highly recommend you take a learning style quiz. There's an acronym for the common types of learning styles. It's called VARC. So V is for visual, A is for auditory, R is for reading/writing, and K is for kinesthetic learners. These are your most common types of learners. And let's just talk a little bit about how each one can change their study styles or incorporate different techniques to be successful. So if you're a visual learner, whatever you can depict in graphs and charts, I encourage you to do so. I enjoy teaching with charts. I don't know if y'all have watched, for instance, my endocrine lectures. I really like comparing and contrasting. I like charts for each disease. You can take any disease and map it out. You can have your disease, you can have pathophysiology in one box, your assessment data in another box, complications you need to look for and the assessment data associated with those complications, your nursing implementation, and your evaluation. And I encourage you to color code it. So that way you can, when you think red, or when the topic asks you what is the priority assessment data for a COPD or client, that color, that red that you put your assessment data will pop into your head. So visual learners, any graphs, charts that you can depict or find online to better help you process information, I highly encourage you to do that. So the next is auditory learners. With the permission of your teacher, I encourage you to record your lectures. Listen to your teachers as you drive home, while you're cooking, while you're cleaning. I had a student, she's like, I listened to you in the bathtub. I was like, a little too much information, but she just listened to me at all times and heard me in her head. So auditory learners, record. Make sure that you are recording your lectures with permission from your teacher. And also, if you're having difficulty, let's say your teacher utilizes a PowerPoint presentation format. If you're having difficulty ingest it, you can read your PowerPoint notes out loud, record it, so that way you have it in an auditory format as well. So any material that your instructor gives you, you can verbally read it out loud, record it, and that way you can ingest the material in the fashion that you learn best. Nursing school is typically geared towards the reader/writer learners. These individuals take a lot of notes in class. They like to read their information over and over and ingest it, or they like to rewrite their information over and over to retain it as best as they can. So the lecture format is really geared towards those type of learners. So again, I just encourage you to keep doing what you're doing in terms of taking notes during lecture, rewrite PowerPoints or rewrite lecture notes, whatever your instructor gives you, multiple times to help retain the information. You can retype if writing hurts your hand a lot, but that tends to help those type of learners be successful. And last is your kinesthetic learners. I feel for y'all. I am hands-on. I understand the struggle, but you need to take the opportunities that the nursing school presents to you in the style you learn. You will shine in lab, simulation, in a clinical setting. So for instance, if you are having a test on renal failure, ask your clinical instructor for a client in renal failure. I know that's not always feasible dependent on the unit you're on. You know, you have different patient populations. But in those settings where you shine, take every opportunity to learn. Ask in simulation if you know you're having a test on burns. Maybe the sim coordinator can work with you and y'all can do a simulation on burns. So lab, simulation, clinical, you shine. So take great advantage of those opportunities. And in the classroom, I know the lecture format does not best meet your learning style, but you need to think about ways that you can stay moving around. Take breaks every time you're allowed to take breaks. Maybe squeeze a stress ball, or some students hold on to paper clips or rub paper clips, just because it's something about you being stimulated in the way you learn best will help you ingest more information, okay? So step 1, know how you learn best. Step 2, ask your instructor how you can best be successful in their class. Every time I get a new class of students, I say, hey, I lay out my rules and I let them know, this is how you can best be successful in my classroom. Some instructors tend to pull the meat of the content onto their PowerPoints. You need to know that, because if you are in, for instance, in a 5-week program, which is what I teach, an accelerated program, I can be teaching them 6 to 10 chapters per day. Is it feasible for my students to read 10 chapters in 1 week? I don't think that's fair, personally, in my teaching style. So I let them know, I've pulled the meat of the content to the PowerPoint. You need to know these PowerPoints in and out. You need to define any terminology you don't know, and then you need to go into that book and read up on information that might not be connecting well for you, or you can't tie the pieces together, okay? Other classes, you have to read. I'll give you an example, specialty classes. I am not an OB nurse. I will never be an OB nurse. I can't tell you the first thing about a fundus. But I do know when an OB client is hemorrhaging, you need to massage a fundus. Versus me, I have a hemorrhaging client. I am not massaging a fundus, right? Not in medical surgical nursing, not in acute care nursing. So it's so different. To understand how to treat a baby and a mother together, to understand the unique differences in this specialty, I really encourage you. I've heard a lot of OB instructors say you have to read the book. If the teacher tells you you have to read the book, you need to read that book. You need to ingest that material. So really, ask your teachers, how can I best be successful in your classroom? Step 3, I tell my students, they will hear from day 1. I teach the fundamentals of nursing all the way to acute care in our university. It's, I teach in multiple spots in the program, but I say day 1, hey guys, y'all will learn that the key to success, the key to develop this critical thinking and to break down these questions that are so maddening, these prioritization questions with 4 right answers, is to practice questions. You need to get your hands on question resources. A lot of times you have an NCLEX prep resource, ATI, HESI, Saunders, Kaplan, and is another good resource. You typically, if your university has a contract with that company, you have access to free question resources. Go to the library. There's always NCLEX prep books you can check out for free. You need to get your hands on question banks. You need to be practicing questions. In the beginning, just get used to these nursing style questions, the wording, the formats. But by the senior level student, you need to be doing questions, and it needs to be incorporated on a routine basis in your study routine. You don't know what will get thrown at you on the NCLEX. You need to be able to pick apart questions, and you will always, with these prioritization questions, be using the nursing process and Maslow's every single time. And it's just learning how to pick them apart will help gear you to that best answer. I know all 4 answers are right. I hear it from my students all the time. I agree with you all, but we still have to help you and assist you get to that best answer. That answer that you walk in that room and you can only do 1 answer for these clients, and you leave and you know you've kept them in the best state possible. Okay, so just to review so far, step 1, know your own learning style. Step 2, ask your teacher how to best be successful in their class, because we all have different teaching styles, not wrong, just different, just like you all have different learning styles. And number 3, we need to be practicing questions. Step 4, please do not be afraid to ask for help. As teachers, we try to catch people that we see struggling and try to pull them aside, we always recommend tutoring, but it speaks volume when a student takes the initiative to seek help. I personally, in my teaching practice, will help any student that seeks help all day. That speaks volumes. That says, hey, I want this. I'm hungry for this. I want to be a safe, competent nurse. I want to be successful. I want to care for patients at the end of the day. And I've heard a lot of reasons why students don't seek help. Maybe they don't think tutoring will be helpful, or maybe they don't feel that their teacher is approachable. I always say, did you attempt? Did you try? Because at the end of the day, we don't know. You can't assume things. Approach your teacher, ask for help, attend a tutoring session and see if it does help you. Ask your teacher, maybe they have additional practice questions for you. But step one is to take that step to seek help. Because at the end of the day, we're only accountable for our own actions. So what did you do to get help or get assistance from your teacher? It speaks volumes when you do. Also, seek help from students, right? Some students are very, very successful in study groups. If you are not a study group person, don't go to a study group. I was not. I needed to study on my own to best retain the information. But if you enjoy study groups, if you feed off other students, become a part of a study group. But think about doing it in the best manner possible. You will develop friends, and I love that. That develops community. You will have people you can vent to and talk to after a bad day at work, or just throw around ideas, or, hey, how can I best help this client, right? But if you and your friend are both struggling in the same class, if OB again, y'all can tell I guess nothing against OB nurses, there just won't be one. If you're both struggling in OB, you all might not be the best to study together. Still study together, but bring in somebody who is strong in OB. Seek help, utilize each other's strengths, right? If you're strong in pharm, help somebody who's weak in pharmacology. If you're weak in OB, find a student who is successful. You want to utilize each other's strengths. Sometimes when you have two friends studying and they're weak in the same subject, you might not be helping each other as best as you can, okay? And the last thing, this is very dear to my heart, and I really want y'all to know, don't compare yourself to another student. You all, if you are called to be a nurse, if you have a heart to be a nurse, you're in nursing school, you're doing it for a reason. You all are so different and unique, and you have your own individual gifts. Do not compare yourself to Billy, to Sally, to Susie. There might be a wonderful test taker in that classroom, right? Somebody who just can go into each test, kill it in the best of ways, and they just have a gift for that. But you might be sitting there and you have the best bedside manner, the most compassionate bedside manner that cannot be taught in any classroom. You have a gift. You all are all unique. You all have your own gifts, and you will shine at the end of the day when it comes to patient care. So I know university settings, just grades alone feed competition, but please don't compare yourself to another student. Remember, there is no perfect nurse. We don't expect perfection in nursing school. At the end of the day, when you pass your school, your classes, and when you pass that NCLEX, that employer will not know whether you are a nurse or whether you are a B nurse. What they will see is how you take care of your patients. So just remember, we are better together. Competition is good in some ways, but don't ever compare or value yourself based upon what another student's doing. You are unique. You will bring your own gifts to the bedside in the care of patients. You will grow in your career. So remember, no perfect nurses. There's no perfect people. So I hope this has helped you in some way. I want to cheer you on and encourage you that you can do this. Just think about how to best be successful. Think about time management, your strengths, and always utilize your teachers as resources. So I will see you the next time. Take care.